What if the problem isn't your product, but your team is not getting the right information when you need it the most? Everyone is talking about value-based care, but only few of them are getting it right. The real breakthrough is solving the team challenges, no longer making them silo, but truly connecting them together. Today, we're gonna unpack what really makes value-based care work.
Welcome to Provider's Edge, the podcast that helps healthcare entrepreneurs and innovators break down barriers and control their business, life, and future with valuable action steps. With me, your host, Sabrina Runbeck, a recovered clinician and a business deal catalyst. Let's rewrite the rules and create a positive social impact while increasing your profitability. Welcome back for another episode. We're here at PointClickCare with Hamad Husainy, who has been a major player in PCC. And all of us at every single event, it's the energetics of getting the users together, seeing how things are working, what they feel like could be the gap that we can create and innovate and continue to build a better platform, as well as have even more people in the marketplace to join, right?
Absolutely.
Get everyone to use and then make it even more adaptable to help some of your clients to see there are a lot more usabilities, and some of these solutions in long-term care, senior care, they don't have to start from square one because you guys has already done so much work. And from a clinical perspective, I'd love to also hear about even your personal experience of what got you so excited about this place and also PCC.
Yeah, absolutely. Thanks for having me. And this is exciting. Going back to even medical school, I remember having this just vision of how in healthcare do we get involved with the macro view rather than the micro view of healthcare? And the micro view is super important, and that's why most of us go into healthcare in the first place. But realizing that intersection between quality and cost is something that just became very sort of almost obsessive in my brain, if you will, early on as a physician. And so as I started my practice, started using Eddie back in the day with Collective Medical as a platform to be able to help improve and mainstream healthcare through the emergency department. Stayed on and did some consulting for them, and here I am with PointClickCare. So it's been a great ride so far. I love what our mission is. I love that we're here to improve the experience for the providers that are providing the healthcare to their patients and their clients. And so it's just an exciting time to be able to integrate all of the data from all the different healthcare systems and be able to bring that together for one reason, and that reason is to improve care for patients that we see. Yeah,
it's about figuring out what they really need from both us as clinicians and us. We have to wear a patient has, like if I'm in that role, if our family, right, and then switch to the caregiver role, what does that look like? How do we need to do? What question do I even have to ask? And I feel like I also gone through that, right? Like burnout in medicine, switching to leadership, changing teams. And then now it's like, let's adapt to solutions because tech can help us and not be in a fearful space of what if it's taking over, analyze the wrong information. No matter what, human can do all that too. And it's about leveraging the tools and having the right people in front of us and believe in the missions and then drive the true changes with the right people.
Absolutely. And I tell patients at the bedside all the time, there's a lot of things I can do, right? But the right thing to do is the right thing to do. And technology should help us create opportunities to do the right thing at the right time. The data and the information provided should be provided to us at the right time to make those decisions proactively instead of reactively. And so if we don't notice, if we're using a product or a platform and we don't notice outcomes that are related to patient care, patient experience improvement, and also provider improvement with regards to their practice, then I think we're missing the boat. And so those are all central themes of what we're doing here at PointClickCare, and it's just exciting to be a part of the team.
Yeah. So what have you been seeing for the past years, because they've been around for a long time? What are the central results we can say, hey, we do this really well, and that really make us the leader in the marketplace?
So, I mean, I think going back to the beginning, right, it was just the visibility to the data, right? The visibility to recognizing that there's an opportunity to address social determinants of health, to address, high utilizers or what have you. And then recognizing like not just that you have the visibility to know that, but then you can actually add to that, and you can participate in the care and the communication of that kind of information across the healthcare continuum. And then sort of like 3.0 was like, now let's proactively go out, case manage, care collaborate. And then the 4.0 is the acquisition from PointClickCare from Collective to PointClickCare is now how do we cross the care continuum. So we go from ambulatory to the acute care setting, to the post-acute care setting. And I really can see a day where we don't even talk about those three settings anymore. And we just call sort of what I term the value-based healthcare system, or the opportunity to receive care across a continuum that is so seamless that you don't even notice that you changed.
Right. We were just talking about that transitional care with Brian specialists, that we often feel like we're the separate entity. It's okay, people come to the ER, they got admitted, now we're diagnosing, running testing, seeing what they're doing. Oh, they need surgery. Okay, let's book a case. And then there's a day to wait until they do that. And then now they're recovering. Now where do they go? Okay, do they need to go home because they have home support? But how do we capture those data when they go home versus they can go to a short-term and long-term facility where they're getting approved, right? That kind of make our decisions difficult. But once they do transition into that, do they have a care plan that people are on top? Or you kind of start square one where you have to sort through all those things? That is very difficult. And so one of the movement, what we're hearing is start to interject AI and analyze, give reports to help clinicians and care teams to understand what to do next without spending a lot of time just sorting through data.
Right. And so we don't have a data problem, right? We have a sort of right place at the right time, problem. And so that's a lot of what we're trying to solve here. We don't need to recreate the wheel. And, the inside of healthcare, we oftentimes see a sort of a pendulum that goes back and forth, right? And so, one of the things that's happening, and I think for us that have gone through medical school and residency, there's silos and there's sort of walls that we put up around what's our job and what's their job, and
right.
and now we're now revisiting in healthcare, modern day healthcare in 2025, that really what my job is to care for the patient. Mm-hmm. What if that means it's outside the walls of the hospital? Well, that means it's my job to care for the patient. Now it's going to take some time to really get there, because that's a huge culture shift. But at the end of the day, when we look at what's the most quality of healthcare that out there for the lowest cost and the most of value, what we're going to land on is comprehensive healthcare that extends across the continuum. And however that's provided, it has to be seamless. It has to be team oriented. It has to be collaborative. It can't be me and you. It has to be us. And so I think for us to accomplish our goals, that's where we got to land.
Yeah, it's that we have to have a shift both on mindset and then culture, and then take the action toward what true collaboration really means, both from a traditional business standpoint, job role creation standpoint, and training perspective. I think we're always being trained to stay in the bound of what you're doing. This is my job role. If I go outside, I'm rocking the boat. Who's going to rock the boat in the wrong direction? Tilt the boat over. Versus I'm brave enough to see the gap that could be, and then I'm intentional about talking to the other department. And in medicine, I think there's a lot more shift into that integration where, for example, cardiothoracic, we're going to have interdisciplinary meetings, right? Every week, especially for the cardiology, going to be there, radiology, anesthesiology, surgeons. All of us need to talk about how do we take care of this patient? Do they qualify for surgery? Which way? Minimal invasive, open, or they should just go medical management? And then I think we have that in oncology, thoracic, in other department. Now it's about taking that into smaller team to bigger scale.
Yep.
How entire system is able to do that cross collaboration, have open communication, how those communication not necessarily bound to human capital of sitting in the room, but instantly already get delivered and sent to the right people.
Well, we have to get better with our data, right? So, historically, being part of those grand rounds, being part of those care collaborative initiatives and meetings, historically, we were just like, well, they're important. How can we put an ROI to them? How can we quantify their value? Because I don't think it's impossible to do. I think it's actually not very hard at all to do, to recognize the difference between doing an unnecessary surgery and managing medically, right? The difference between doing, not doing anything and doing a surgery that possibly allows someone to improve more drastically and keeps them out of a post-acute care facility and out of a long-term care facility. And so it's hard to sort of articulate and it's hard to sort of postulate, but I think there's a real opportunity, especially using AI, especially using, predictive analytics and other things of that nature, to be able to have the best chance to make the right decision at the right time, provided with the right data at the right time.
Yeah, it's also then we can help them in the progress of what that journey looks like. And a lot of challenges, I think people would say, well, why did we not talk about this before, to already think about if they need acute care, long-term care, or they can go home, or they really have nobody home to help them, and then it's not safe for them to go home by themselves. So how come we didn't have this conversation before? Now it's go back to what if they just came into the ER? This is not something they're even aware, and even they're aware, patients can still be in that denial phase of, I don't feel bad, until something happens.
Right.
And at that moment, if we didn't have that interdisciplinary communication, whether it's the AI helped or you physically in a room, then how can we then trigger those pathways? We couldn't, right? There's no care plan.
It needs to be pushed. It needs to be standard. It needs to be articulated well. It needs to be defined well. And but at the end of the day, in 2025, it needs to be technology driven, right? Because there's no way that us as humans can analyze and act on data, raw data, as quickly as our technology can. And so I think there's a huge opportunity there across the entire care spectrum for collaboration and coordination for all patients, whether it's in the emergency department, whether it's the surgical, post-acute, acute, ambulatory, across the entire spectrum.
Yes. And who would you say in the rest of the 2025, now we're in Q2, like going really fast, who are your main people that you really want to drive these messages?
Yeah, I mean, I think we have to get to the point where we are looking at these things from a team landscape, from all of the healthcare providers, but also the payers, right? Whether we're talking about ACOs and insurance companies, but at the end of the day, like, we all have to be rowing the same direction, and we don't have to be antagonistic. We can be a team, and so as we continue to formulate and visualize a day where value-based care is the norm, like there's really no other such thing, I think that we have to get closer and continue to row in the same direction, work off the same sheet of music from the standpoint of data. And if we're doing that, I think we can have civil discourse and we can have disagreements, but we can get to the ultimate outcome, which is better patient care.
Yes. So next, we wanted to have more people who are in the payer space, the insurance space, and ACOs to come into the table to look at PCC of how do we leverage PCC to create that continued loop of communication, open communication, and making sure everyone is getting the right information.
Absolutely.
I always love to end with a fun question.
Okay.
Now, when we give you a magic wand and grant you 3 wishes, what are you going to use for?
So in healthcare or anything?
In healthcare.
In healthcare.
Especially
all right.
PCC.
So I would say that I would love to get everyone moving towards a data-driven and backed healthcare rationale for why we operate. I would support both for-profit and non-for-profit healthcare organizations through aligning with their initiatives, as long as they're centered around patient care. And the last thing I'd do is I would eliminate all the paper that exists. and get rid of all the paper and institute a paperless system.
Yeah, we do see a lot of private practices still on paper. And when you talk to them about like remote care integration, we're like, oh, you don't have a platform for us to even integrate, right? And then you have to really think about how to get them on speed first.
That's right.
And one of your long-term care facility, one of the panels was talking about how quickly they're able to integrate EHR and then create these meaningful changes. So definitely is there. So as we wrap up, how can we ask the community to support PCC?
Yeah, I mean, I think in general, it's, being part of the network it requires some degree of vulnerability, but it also requires some degree of vision. The vision that we have here at PointClickCare is to create a network of post-acute and acute providers, as well as payers and ambulatory clinics and home health and all of the like, right? But in an effort to create a ecosystem where we can share real-time information at the right time and eliminate waste and improve patient care. And so if I had a plight or a plea to our communities and our health systems and our post-acute care facilities, is I get that there's a lot of security issues and things of that out there in the space, but we're a trusted partner and we have a mission that is absolutely critical to improving healthcare and patient care going forward.
Amazing. We appreciate you joining us. How can people have a deeper conversation with you? What's the best way?
Find me on LinkedIn. I love LinkedIn. And also my email, hamad.husainy@pointclickcare.com.
Perfect. Appreciate everything that have been discussed. For all of you guys who are listening, watching, we would love to hear from you. Let us know, how are you creating solutions in that integrated way where you're creating streamlining work, create closed loop communication. The transitional care seems like easy and not cumbersome for whether you're in the payer seat, ACO seat, system seat, acute care or long-term care. How can we all come together to the table? What are you doing? And then how can we make that even better for you? Until next time.
Thank you.
Thank you for tuning in to Provider's Edge podcast. We hope you enjoy our latest episode and found the insights and tips helpful. We'd love to hear your feedback on the show and learn what topics you'd like us to cover in the future. So please take a moment to leave us a review on your favorite podcast platform and let us know what you think. Your feedback is essential to help us improve the show and provide you with the content you need to take your healthcare business to the next level. Thank you for your support, and we look forward to hearing from you soon.